My next question is to Dr. Stergiopoulos. I hope I'm saying your name correctly. If not, I apologize. Doctor, you already mentioned the underlying social and economic conditions that contribute to poor and exacerbated mental health conditions. I'm going to quote a sentence that sort of struck me from a publication by Rochelle Burgess from the University College London, who said, "A woman who has lost her job and cannot feed her family will find little relief from a meditation app. Advice such as stay off social media will do little to ease the anxiety of a young Black man in constant fear of being kicked out of shops by security guards for wearing a face mask or abused or even more." And let me add to this what we heard from Dr. McGrath just recently, that even if you are given advice to engage a psychiatrist or a psychologist, it may well be out of your financial means. What then, in your view, is the best way to deal with the mental health conditions of marginalized communities, and how can the government best support these initiatives?
I think my question will have two parts. The first one, what are we doing now for the crisis now, and what do we need to put in place so that these individuals that are currently facing severe and multiple sources of disadvantage have better access to care and supports. For the crisis now, different communities have come together in different ways to support vulnerable populations, from providing support and capacity building opportunities for professionals that work on the field, whether it is for professionals working on intellectual and developmental disabilities. There are programs that build skills on how to manage COVID, how to support this population during COVID. So that's an example. Or there's another program I'm aware of that again builds capacity on managing other disadvantaged populations that live in indigenous communities. So that's one part of the response. What do we do now? Build capacity, help our helpers do their best given the circumstances, and improve access to coordinated and comprehensive supports through centralized access points, that one-stop access. And this is what we've tried to do definitely in the Toronto region. And this is what Ontario is trying to do. I'm not aware, unfortunately, what's happening in other parts of the country, and how the different steps in the step care model are coming together to support those that are vulnerable. In addition to efforts that we're doing, and I'll give you my experience, I still work in a shelter. We have, if you like, adopted group homes and shelters in each geographical region, and hospitals and providers with more resources are stepping in to those settings to support them, to support these populations. So that's the crisis component of our response. But in the long term, the investments, as you heard from all of us, in adequate income in whatever form, adequate housing, and adequate access to evidence-based community supports is what is going to be helpful. Until people with mental illness have adequate housing, until our psychiatric units are adequately resourced, we will not be able to address these issues.